guys, it's Khaki. Today, I want to talk to you about a question that a viewer posed, a video suggestion. So, let me read the original comment and then we can talk about it. This viewer says, can you do a video on talking to a PCP or healthcare provider who instead urges you to diet and exercise and use GLP-1s even after telling him you did that to no sustainable means? It was yo-yo weight loss, then weight regain. The pendulum was never stable at the right weight and negatively impacted your quality of life. So let's talk about it. A lot of us struggle with bringing up our thoughts on possibly having bariatric surgery to our PCPs, as well as to other folks. But let's focus in on talking to your PCP. Your PCP should be the person who helps you explore options for a sustainable weight loss and better quality of life. I can speak to my own experience both as a patient and a PCP. When I have someone come to me and ask about achieving a healthier weight and lifestyle, I will talk to them about what have you done previously. It is very rare that I will get somebody who comes to me and says, I want to lose weight. I want to get my blood pressure down. I want to get my cholesterol down. And I say to them, okay, what have you tried so far? And that person says, well, nothing. I don't think I've ever had anybody do that. I will have somebody say, I've tried it all. I've done Weight Watchers. I've done low carb. I've done, going to Planet Fitness every day. I'll lose a little, then I gain it right back. At that point, I will say to them, okay, well, it sounds like to me that you've tried quite a few things, and for whatever reason, they were not successful in the long term. What are you thinking you would like to do? A lot of times at this point, people will bring up GLP-1s. We have all seen on TikTok, we've all read on the internet about GLP-1 medication. It is a wonderful class of drugs. I use them a lot in patients. However, some people just do not respond to them. They are out of reach cost-wise for many patients. Insurance coverage is still not what it should be. And then you have the availability. We struggle with shortages at the pharmacy in these medications. So, if you are going to a primary care provider and you have done your research and you think, I really think I'm a candidate for bariatric surgery, my suggestion is go to your PCP and say, I want to get healthy. I would not use the words lose weight as your lead because, in the end, that's really not your goal, is it? Your goal is to get healthy, to possibly get off medication, to be able to move more, to be able to fit in an airplane seat without using a seatbelt extender. Those are really your goals. Yes, the weight loss enables you to do that, but leading with I want to get healthier, I think really tells your PCP this isn't a passing fad. This is something that I want to do, not just to fit into a dress for a wedding I've got coming up. I want to do this for bigger things. If your PCP says, well, you need to eat less and move more, I would say, I've tried that. I've tried that. And it hasn't worked for me. I may lose weight and I gain it right back. Or, for whatever reason, the GLP-1s are not an option for me. I've either tried them, didn't sustain the weight loss, I had side effects, or my insurance won't cover them, the cost is untenable, or I would say to them, yeah, I understand those things are available, but I want something more permanent. something that I don't have to worry about injecting myself every week. I'm not sweating it when I go pick up the medicine at the pharmacy, wondering, is it going to be in stock? Wondering, is my copay going to be higher than I can afford this week? So I think that saying those kind of things, as I said, I think GLP-1 medications are great, but are they great for everybody? No. The other thing that I would encourage you to do your research. Know why you want to have bariatric surgery. Know what besides weight loss that bariatric surgery is going to do for you, so that when you bring that up to your PCP, you have information. You can say to them, yes, I understand eat less and move more may work for some people, but for those of us who have the disease of obesity, that have something that we are struggling with, that doesn't work in the long term. And I would encourage you, there are 2 videos that I really encourage you to watch. One is a little more clinical, but both are by a doctor, a bariatric doctor who is a professor at Harvard, Dr. Lee Kaplan. One of the videos talks about why bariatric surgery is so powerful and the changes that it makes. And the other one is a little bit more general on the disease of obesity, discussing how obesity works and how your body fights to stay obese, and how some of the medications and bariatric surgery are really the only effective tool in combating this. The other thing that I would encourage you to do, if your PCP shuts you down when you bring up bariatric surgery and you feel like this is truly something that you want, find another PCP. That's a hard thing to do. It's hard to give up that connection. But if your PCP has a bias against weight loss surgery, I think your PCP probably also has some underlying bias against people with the disease of obesity. That's the bottom line. And you do not want to entrust your health care to somebody with that kind of bias. So guys, I hope you have a wonderful week. I hope this video was helpful to everybody, and especially to the person who suggested it. I would love to hear video suggestions. What would you like to hear me talk about? What topics are you struggling with? I hope you have a great week, and we will see you next Wednesday. Bye. So after I made that video, I had some additional thoughts that I just wanted to put in. When you go to your PCP, talking about obesity bias, I want you to look around your PCP's office. Look for things that are made to make obese patients comfortable. For example, are there chairs that you can comfortably sit in? Is there a scale that goes up to a weight that you can be weighed on? When you weigh, do the staff make any, I hate to say negative comments, but do you feel like you are getting a negative vibe from them? That is key. I think that you have got to be comfortable with your PCP. The other thing that I wanted to bring up is talking about doing your research. You have obesity. That is your condition. That is my condition. And as a primary care provider, we don't know everything about every condition. I will be the first to say, often patients will come to me and know more about their disease process than I do, because it's something that I don't deal with every day. Now, obesity is something that most PCPs do deal with every day, but maybe it's something that they've never struggled with. And when I have a patient come to me who knows truly educated about their disease process, not something that they heard on TikTok, not something that they read from some naturopath, but when they truly are educated in what is going on with them, I have such respect for them. And I use them as a resource. So when you educate yourself about obesity and treatments for obesity, that when your research is grounded in science, then I think that is key to having that dialogue with your PCP. And maybe you can educate them as well. That's why I recommended the videos that I put the links down. They're by a Harvard professor. If you go into a conversation with your PCP and you say, well, I saw this video by a Harvard professor who specializes in metabolic disorders, in obesity, and this is the information that he said. If that doesn't impress your PCP, I think you probably need to look elsewhere. Just a thought. Bye.